Now, all right. So today is the second day of this 2 day intensive class on labor and delivery. And this is actually a branch of reprogens. So we are reprogens antenatal care. And yesterday we tried to tell you what we are about or who we are. Anyway, we are just a healthcare organization that is basically concerned with the sexual and reproductive health of everyone. So that's basically what we do. All right, we anything that has to do with reproduction and sexual health. That's what we are totally concerned. So antenatal care is one of them. So today we say we're gonna discuss cesarean section. Please, if you can see the screen, can I have a thumbs up? Let me know that we are following. All right. So this is the table of contents for today. So we're discussing how people perceive cesarean section, what cesarean section is, the various myths about cesarean section, indication and type of CS, complications of cesarean section, pain management in labor, and then we'll conclude, following which we will answer as many questions as possible. So let's try and do a little recap of what we did yesterday. So yesterday we discussed basically everything about labor. We talked about the definition of labor, and one of the things that we said was that labor is not sweet, but it's totally worth it. And I know that this first picture was displayed yesterday. The picture was displayed, and we said that many of you who are pregnant now, a time will come when you'll be like this is the picture of a woman in labor who is actually having very serious labor pain. And we also went ahead and discussed about vaginal examination. You can see this hand on glove, and said that we know it is uncomfortable and you won't really find it funny just to allow maybe a stranger, let's say a male doctor, to just go ahead and examine you. However, it is totally it's necessary, because that's the only way one can know whether one is in labor or not. That's by examining you vaginally to check the cervix. Then we talked about tears in labor. Unfortunately, this picture here was not posted yesterday. This is the picture of episiotomy. We talked about episiotomy. So this is the picture of episiotomy. You can see this cut here that was given just to widen the vagina for the head of this baby to come out. All right, so this is just a brief recap of what we did yesterday. The recording is available, so by the end of these classes, maybe from tomorrow, we'll compile them and post, and then give you a link to join. A link to listen to them or watch them all over again. So let's just get started. Please, if you are with me at this point, let me have a thumbs up, please. All right, thank you. Okay, what we want to discuss today, we are going to discuss it without bias. So the first thing is, how exactly do people perceive cesarean section? Normally, outside the confines of a hospital, or even those in the hospital, the moment any woman hears about cesarean section, like you say, okay, madam, you will be having CS, the very first thing you will hear is, God forbid, So such person will start casting and binding you for telling her that she will likely deliver through cesarean section. That's to tell you that that most people, probably because of orientation, because of ignorance, because of their religious biases, most people don't want to hear CS. And you even hear in our churches, maybe some uninformed people, they'll be saying, no, you must deliver vaginally, even when the woman's obstetric history is not favorable at all for a vaginal delivery. So nobody wants to hear anything about CS. But unfortunately, at least 30 to 50% of pregnant women will end up having CS. All right? They will end up having CS. So cesarean section is not bad at all. In fact, these days, some people who have tested cesarean section these days actually find it easier. They will just say, no, doctor, we are going for cesarean section. I don't want to bear the pain of labor. So the good thing is that a lot more people are getting to know about cesarean section. A lot of people are getting acquainted with the importance of CS. But generally, all right, most people don't want to go through cesarean section. But before you conclude and say no, that it is not your portion, you have to put certain things in consideration. Number one, why are they saying you will have CS? Why? We are going to see the different reasons why people have cesarean section, and we'll also highlight the myths about cesarean section. But just know that you are not the only one. No, so many people do not like CS. So many people, they don't like CS. If you just hear it, God forbid. And unfortunately, again, I'm not really trying to. I don't have much time to start telling you stories. So many women have lost their life in pregnancy and in labor because they declined cesarean section. Just imagine a situation where, okay, let me just tell you a little story. In 2019, please, if you can hear me, let me have a thumbs up. Let me have a thumbs up, please. Thank you so much. Now, in 2019, as at that time I was okay, there was a facility I was working. I will not mention the name. Now, usually when there is problem in the labor room, they will call me, doctor, come and review this woman. She's not progressing, or there is problem, and I will usually run and go answer them and all that. So on this very day, I was called. They said this woman has been in labor for maybe about 8 hours, and they saw that this labor was not progressing, and that the way it is, the head of the baby was not coming down at all. There was no fetal descent at all. They called me. I assessed the woman and found out that she actually have what we call CPD, cephalopelvic disproportion, which simply means that when the baby's head is bigger than the pelvis, so the baby's head cannot pass through. So what did we do? We counseled and said, okay, madam, the way it is now, see the findings, you will end up having cesarean section. Let us book you. We pleaded with her. The woman was impatient. She didn't have much of a choice. But the people that came with her were the problem. The woman's relative and the woman's husband. They say, no, nobody in our lineage has ever had cesarean section. God forbid. We persuaded them, they refused. We said, okay, since you don't want to have CS, this woman is not going to die in our facility. So what did we do? We gave them a form to sign. That's DAMA form, to be discharged against medical advice. They signed the form and left. They now went to all these women that deliver people. We talked about them yesterday. All these traditional birth attendants, all right? They went to them. They sat on the woman's tummy, did everything. They pressed and pressed and pressed and pressed. Nothing. When the woman was very weak, extremely weak, since they had already signed and left our facility, they went to another hospital. This is not a fabricated story, it's a real life story. That same cesarean section that they rejected for over 10 to 12 hours, the woman ended up having the CS. Unfortunately for her, she died on the theater table with the baby. Now, this is a very sad story because there is no reason why we wouldn't have saved that woman's life. But because of people's orientation towards CS, our family, we don't used to do CS, our this and that. That was a very devastating story. There was also another story. This one, money was not the problem. Money wasn't the problem. By whatever means or reason, this other lady who has actually had one previous cesarean section, instead of, and the doctors counted and said, you have to deliver in a hospital. You have to do this and that. This other woman, she went to the same traditional, these local places where they deliver people. She went there. I'm not exaggerating. Why they tried everything, they gave oxytocin, they gave drip, gave all this thing and what have you. At the end of the day, baby refused to come. By the time they rushed the woman to the hospital I was working, that was around past 12 at night. The lady came, and by this time she was exhausted and everything. I rushed her to theater for emergency cesarean section. All right. The moment I opened up, blood everywhere. Her womb has ruptured. While they were doing everything, trying to force out the baby, the womb ruptured. The baby died. In fact, she ended up losing her womb. Why? Because she declined. She refused to listen to her doctors. Unfortunately, she wasn't even in our facility, but they rushed her to us after everything happened. Now, what am I trying to say? People do not like cesarean section. So if you have if you're among those who do not like cesarean section, good and fine. I hope that by being in this class today, by the time we talk about different things and different reasons why people have CS and the advantage of having cesarean section, you will have a different orientation. Please, if you are still with me, let me have a thumbs up, please. All right, so let's kick off. Definition. Cesarean section is the surgical delivery of the baby through an incision made in the lower abdomen and uterus. Now, this simply means, without speaking too much English, okay? Cesarean section is simply operative delivery. It simply means giving birth through operation. Now, the moment a woman becomes pregnant, if the pregnancy does not end up, or if she doesn't end up having miscarriage, okay, then the pregnancy will develop to term. The moment a woman becomes pregnant and the pregnancy is term, that baby must come out. Baby must come out either through the vagina or through the abdomen, that is through the stomach. Talking about operation now. Okay, now what this simply means is this: if you are pregnant, that baby must come out. Now, when you have tried vaginal delivery, or maybe if the indications do not favor vaginal delivery, you are gonna have operation to bring out the baby, and it is called CS. So CS, or cesarean section, is just delivery through operation. All right. Now, the myths about cesarean section. We are going to list 7 myths about cesarean section. Myth simply means 7 misconceptions that people have about cesarean section, or 7 lies. Myths is just misconception or lies people, or misinformation that people have about cesarean section. Please, if you can see this screen, let me have a thumbs up. You can see this screen. Let's have a thumbs up, please. Thank you very much. Thank you. I see you guys. So the very first myth is cesarean section is for weak women. Cesarean section is for weak women. Now, this is actually, those days in our villages and all those things, if a woman has cesarean section, people will say she is weak. That is because she cannot push, she cannot do this and that. Wow. That is a lie. It's because of ignorance that makes people to say those kind of things, because they don't really know. Those people don't know. It is not because a woman is weak. Okay, imagine a woman whose baby is lying across. Your baby's head is by your side, not down. Come on now, how will that baby come? Are you going to fold that baby into two? You can't. Imagine a woman who has a very big baby and the baby cannot force through the vagina. Are you going to tear that woman into two vaginally? So cesarean section is not for weak women. Even if it's for weak women, everybody are not the same. Everybody's strength is not the same. All right? Because we are going to see some of the reasons for CS. One of those ones include maternal exhaustion. When a woman has been laboring for hours and she is tired, what do you think will happen again? So please, all of you should know that cesarean section is not for weak women. And if you see anyone, whether men or women, who will say that CS is for weak women, please kindly correct them, because it is a misinformation. CS is not for weak women. People don't have CS because they are weak. All right, there are reasons why a woman will have CS, and being weak is not one of them. All right. Number 2, one cesarean section can stop you from having a vaginal birth subsequently. And before I explain this, I said if you have any question, please you write it down. At the end of this class, we answer all the questions. All right. So the second misconception about CS is that one cesarean section can stop a woman from having a vaginal delivery. That is not true. It's not true. There is something we call vaginal birth after cesarean section. Please, if you can hear me, let me have a thumbs up, please. Let me just be sure that we are following this discussion. All right. Now, there is something we call vaginal birth after cesarean section. If a woman have one cesarean section, all right, she can, in the subsequent pregnancy, she can attempt vaginal delivery. But there are conditions that has to be met before such woman will be allowed to attempt a vaginal delivery. That is after one cesarean section. One of the conditions is that she will have to enter labor by herself. For a woman that have had one cesarean section, when she's pregnant for the second time and she wishes to deliver vaginally or to attempt vaginal delivery, the woman will have to enter labor naturally, no induction. Now, it is because of this rule that we make a woman that have had CS before to abandon the hospital and go to a traditional birth attendant to deliver the baby, because the woman don't want to listen to the doctor's instruction. Meanwhile, it's the reason why a woman who have had one cesarean section will have to enter labor by herself is because when you are induced, remember that yesterday we said that for some people the pain can be more in induction. So when you are induced, the contraction of the womb will be much in such a way that because you already have a scar on the womb, it can maybe lead to rupture. The womb can burst. So we don't want to take any chance with any woman's life. That is why if you had one cesarean section, we say, okay, labor have to start naturally. Number 2, please listen to this one very carefully. If you have had one cesarean section, okay, before you can even attempt a vaginal delivery, that cesarean section must have been at least 18 months, a year and a half. So that means if you had CS now, then after 6 months, you became pregnant, my dear, it is going to be another CS. So for some people, they say that you will have to probably be 2 years before you get pregnant again. But that's not really true anyway, because things have changed. So right now, there is another teaching that said if you had a previous cesarean section, you will have to wait for at least 1 year so that you can become pregnant. That means if you wait for 1 year before being pregnant after a cesarean section, by the time the pregnancy stays for 9 months, that will be 21 months. All right, and so you can attempt a vaginal delivery. But if from the time you had the CS to the time that you are entering labor again is less than 18 months, it is going to be cesarean section again because we don't want to take chances. Do you understand that, please? Then again, if you have had one previous cesarean section, all right, for you to attempt a vaginal delivery, okay, the baby should be less than 4 kg. That means the baby should be weighing around 3.5 kg or less, because we do not want you to go and start laboring with a big baby after a previous cesarean section. So this myth that says that one cesarean section can stop you from having a vaginal birth subsequently is not true. All right. Number three. The next myth said cesarean section is very painful. Cesarean section is very painful. That is not also true. Now, in fact, the pain of cesarean section is less than the pain of vaginal delivery, because during cesarean section you are given medications, all right? It depends on where you are. You can be given spinal anesthesia and you will not even feel pain. You will even be awake. You will not feel pain. You are given different kind of medication that will make you not to feel pain, and the surgery will be carried out, all right? The only pain you feel after cesarean section is when the effect of the drugs you've given has worn out, okay, you will start having pain. But it's just like every other pain, of which if you are giving pain relief, the pain will stop. And don't also expect that the pain that you will have after CS will just vanish in one day. No. The same way that if you are slicing vegetable in your house and you mistakenly slice your hand, you know, that is a little cut, or you are trying to trim your nails and you have a cut in your finger. You know, even that one doesn't heal in one day. So you don't expect to stop feeling pain the following day after having a CS. Your body will need a little time to heal. But CS is not as painful as people make it to be, because after the surgery, when the effect of the drug that you were giving has worn out, you will be on pain relief. All right. I hope you understand that. Number 4, people say that you will bleed uncontrollably after cesarean section. That is a lie. You will not bleed uncontrollably after cesarean section. Yes, you are going to lose blood in the course of the surgery, but most of the CS I've done, such women were not even transfused. And that is why we say that you must build up your blood adequately. Build up your blood adequately before you enter into labor. There are many women, I know that some are also in this group, who have had cesarean section without transfusion. But if before you have the CS or during the CS, it is discovered that you will need to be transfused, of course, we will transfuse you. All right? But you will not bleed uncontrollably, because by the time we cut you open, whatever blood vessels that are bleeding, it will be tied and you will not bleed. Do you understand? So you are just going to lose a minimal amount of blood, or just a moderate level of blood that will not put you in trouble. So CS do not make a woman to bleed uncontrollably, except in cases where maybe there are several other factors. But primarily, CS do not make a woman to bleed uncontrollably. Number 5, you will not be able to breastfeed your baby. You will not be able to breastfeed your baby. Now, this is one of the lies as well that people tell. After cesarean section, okay, yes, I can agree with you that after CS, maybe within the first 24 hours, a woman might be very weak to start breastfeeding. But so many people that had CS, within the first 3 days, they can commence breastfeeding their baby. So what we do is this: if a woman is weak, too weak to start breastfeeding her baby after cesarean section, the baby can be commenced on baby food. Do you understand? Baby food, all this one that they sell in the market, let me not call names before you start asking me which one is the best. All right. So the woman is commenced on baby food. The baby is commenced on baby food. All right. Now, the moment the mother, that's the woman now, can breastfeed, the baby is put to breast. So if a woman actually wants to have exclusive breastfeeding, she can still have exclusive breastfeeding the moment she starts lactating. Okay. So a woman that has cesarean section can breastfeed her baby. Okay. Let's go on. Number 6. Please, if you are with me, let me have a thumbs up, please. Number 6. All right. Many of you have seen this one. No, cesarean section is not the will of God. Cesarean section is not the will of God. Really? How can CS not be the will of God when it is a life-saving procedure? The women that rejected cesarean section and died, was it the will of God for them to die? Do you understand what I'm trying to say here? Those women that refused cesarean section and they lost their life or lost their baby, was it the will of God that they should lose their baby or that they should lose their life? I know that there are some organizations, maybe churches, that people go to, and they will preach and say, you will never have CS. You are going to deliver like a Hebrew woman. Okay, it depends on what you mean by delivering like a Hebrew woman, no? All right, but let us be guided where we go and what we listen to. Cesarean section is the will of God. Everybody cannot deliver vaginally. All right, everybody can never deliver vaginally. In fact, I have seen people that without any reason at all, they'll be like, no, I don't like stress. I don't like stress at all. Me that will be in labor, I will now go and experience pain for 12 hours. Doctor, just book me for elective cesarean section. Simple. You walk in, have a baby, and leave. No pain. All right. So, if you are in a place, or maybe your relative or whoever is saying that CS is not the will of God and all that, please don't listen to them. All right, don't listen to them. Every woman wants to deliver like a Hebrew woman, but do you even know who a Hebrew woman is? Sorry, shots fired. All right, do you even know who a Hebrew woman is? All right, it's okay. So discard that idea. All right. God can pass through any means to deliver anybody. All right. And there are people whose medical condition do not support them having vaginal delivery, so they must have cesarean section. Declining to have CS when there is no or everything indicates that you must have CS can actually land you in trouble. Number 7. This is the last one. You will sleep and not be able to wake up after cesarean section. This is also another lie that people tell to discourage people. All right, this is a lie that people tell to discourage people from having CS. Meanwhile, you know that if you do spinal, like during your CS, if you give spinal anesthesia, you know that you will be awake and the procedure will be ongoing. Yes, if you did spinal anesthesia, you will be awake while the procedure is going on. Very much awake. In fact, during surgery, when a woman is on spinal anesthesia, we'll be gisting with her. So, madam, how are you? How is this? And now, most hospitals, they use spinal anesthesia because when the baby come out, we have to show you, okay, madam, this is your baby. What is the sex? You now tell us it's a boy or it's a girl before we now go and clean up your baby. Remember that many of you that go to scan to go and check the gender of the baby, they will always tell you that they are not 100% sure. So this is likely male or likely female. But when you now deliver, we know the sex. We have seen people that they are told that your baby is female, then when they deliver, the baby will be male. So even during this cesarean section now, we want the woman to be awake to confirm the sex of the baby for us so that she will not say that they have exchanged her baby. So Even if you are giving general anesthesia, you will wake up. So if you see anyone who is lying to anybody that when you have CS that you will sleep and not be able to wake up, please just send the person to me. Let me pray for the person or counsel the person, okay, appropriately. All right. Now, some other myths, all right, surrounding sex, that they will say that in our family we don't used to have our babies through CS. In our family we don't used to do this. Please, when anybody tell you like that, just tell them that you have heard. You've heard. Don't even argue with them. If you have time, you can teach them. But if you don't have their time, just tell them that yes, you've heard, and go about your business. That's okay. All right. Thank you. So, please, if you are with me up to this point, let me have a thumbs up, please. All right. Types and indication of Caesarean section. Types and indication of Caesarean section. We have two types of Caesarean section. We have emergency CS and elective CS. Emergency CS and elective CS. Emergency CS simply means that maybe this condition, this Caesarean section cannot be postponed. So that means as they hot, you dey carry the woman go theater. Do you understand? You cannot postpone it. That's the emergency. That means if you postpone it, please, can you still see my screen? Can you still? All right. Thank you. All right. Thank you. Now, that means if the indication for the CS is emergency and you postpone it, the baby might go, or both the baby and the mother might go. So emergency means emergency. Meanwhile, elective CS is the one that you'll be told, okay, madam, we are going to book you when you are 37 or 38 weeks. So you come to the hospital on Tuesday, we admit you, and then we have the surgery on Wednesday. I hope it's okay by you. Everybody is taking their time. Why? Because there is no urgency. And we are going to be discussing the reason why a woman can have emergency CS or elective CS. Let's go on. The first reason is fetal distress. When a woman is in labor and she's having all those contractions, all those pains and what have you, and along the line it is discovered that the baby, all right, that the baby is in trouble. Normally, the normal fetal heart rate is 120 to 160, all right, beats per minute. When a woman is in labor and the fetal heart rate starts going to 170, 180 and above, that is fetal distress. Or maybe after some time, the fetal heart, that's the baby's heart, starts coming down to 100, 90 something, that is trouble. Because from going up to 180 or 170 something, and then it now starts crashing to 100, that baby is going, So in instances like that, when even if the woman can deliver vaginally, but for the fact that the baby do not have much time, she has to be rushed into theater to save her baby. Do we understand? Number two, the second reason why a woman can have emergency cesarean section is maternal exhaustion. Imagine a woman who has been laboring for some time and she is tired. Even if she reaches full dilatation, that is second stage of labor, she will not be able to push. Maternal exhaustion. So when a woman is very tired in labor and cannot cope again, the next option is for her to have a cesarean section. Okay? Number three, prolonged labor. Imagine a woman who has been laboring for 24 hours. Now, 24 hours in pain, 24 hours of no sleeping, 24 hours of dehydration, 24 hours of severe exhaustion, severe tiredness. Even the baby self is even tired. Prolonged labor. If you are in labor and your labor is taking unnecessarily long duration, you have to enter cesarean section, sharp, so that you will be fine, so that your bundle of joy will also be fine. Yesterday we said that it's not just about having a vaginal delivery, but the child that you delivered, how fit is the child? We mentioned that some babies, when they are born, because of maybe asphyxia, they were born and they could not cry immediately after delivery, that it can damage their brain, not that the baby will not do well afterwards. The child will not be attaining all those developmental milestones. When the child is supposed to be running, the child will still be carried about by the mother. Okay, now in cases of prolonged labor, the baby can enter trouble, such that if you now succeed in giving birth vaginally, such baby, there will be trouble. Imagine a baby of 3-4 years not being able to walk, still crawling. All right, so prolonged labor is an indication for emergency cesarean section. Number 5, cephalopelvic disproportion, talking about when the head of the baby, or when the baby's the baby's head is bigger than the birth canal, is bigger than the vagina. So that's not vagina, is bigger than the pelvis. That's the pelvic cavity, that hole in the pelvis through which the baby passes through. When the baby's head is bigger, all right, or you have a very big baby that cannot pass through, it has to be cesarean section. And in some cases, you wouldn't really know if a woman have a big baby. In some people, when you do scan, the scan may not be very adequate in telling you that your baby is okay, or baby is not okay, it's not big or big. So by the time you now enter labor, and then you are now in the active phase of labor, you will now labor and discover that the baby cannot pass through. It becomes emergency CS. Do we understand? Please, let me have a thumbs up if we understand. All right. Now, number 6, talking about placenta previa. This is low-lying placenta. If you do a scan, the scan will always show, okay, where the placenta is. So in your scan, you can have that the placenta is anteriorly or posterior, that the placenta is not low-lying, and all those things. Okay. Now, let's assume that a woman actually has a low-lying placenta, and you know that in low-lying placenta, women that have low-lying placenta, they can bleed at any time. So this woman is going about her business, and suddenly she starts bleeding. She's not in labor, but she starts bleeding because the placenta is low. In that instance, when she comes to the hospital, it has to be cesarean section. And in fact, if she does not come on time, that baby will go. I hope we understand. So you did not plan anything. In fact, you are still going about your business. You are in your shop or your market or whatever it is, and then you start bleeding because the placenta is low. At that point, my dear, it is emergency cesarean section to first of all save your life before saving the baby. Because in cases like that, we have to do everything possible to save the mother. As long as the mother is fine, she can always have another baby. I hope we are here, right? It's okay. And then another indication of emergency CS, inability to bear labor pain. Hello. We have a lot of baby girls in this place. Hi. Please, if you're a baby girl, let me see your thumbs up. All right. Baby girls don't like pain. No, please, nothing should stress me. Labor pain. So all these our Gen Z mothers, that cannot bear pain. So you now see, even before the labor starts, they are already crying. I cannot do this. I cannot do this. No. So let's be serious now. So if you know you cannot bear pain, please don't attempt vaginal delivery. It is short and simple. I hope you can hear me very well. All right. All right. So, on a more serious note, if you cannot bear pain, and the place you are giving birth do not have the facilities for epidural, or maybe even if they can, maybe you cannot afford it, I beg, just gently go and have a cesarean section. All right. So some people who cannot bear pain, actually, they may end up having cesarean. They will end up having cesarean section. So these are just the few reasons why a woman can have emergency cesarean section. Now remember that we say that emergency CS cannot be postponed. Cannot. So that means as it dey hot, you are going to theater. This one it's not the one that you will say, let me wait till tomorrow we have it. It's a lie. And the mistake that a lot of people make, I have seen it and it breaks my heart. When you book a woman for emergency cesarean section, they will say, no, wait, so let me call my pastor. Pastor there where he dey call pastor. And then when you call the pastor, he will say, okay, that you should wait, let him come first. As who? As the surgeon? I have no issue with pastor. I go to church too. I'm a Christian. But come on, if you call your pastor while he's praying where he's praying, okay, let the doctors be doing their work. Imagine us not trying to give you extra 1 hour for the pastor to come and lay hand on you, or to give you olive oil to drink. Come on now. Does the baby have 1 hour? You self, do you have 1 hour? And let me say this again, because you are all women in this place. For some of you, your husbands are very stubborn. We have had cases where a husband will say, no, my wife cannot have CSO. My wife cannot have CSO. Imagine that kind of thing. My wife cannot have CS. Kiniko. And then he will delay until there is problem. And that is why we say that women must be empowered, so that when it comes to matters like this, where it is a matter of life and death, even if the husband is not at home or not around, they can sign consent and have the cesarean section done, so that their baby and themselves can be fine. I think I'm going far. Let me just stop. Maybe we are not ready to hear this. But it's true. So you must be empowered to take decision if it comes to that. Don't tell me, they say they say, my dear, your life is on the line. So having said this, when you call pastor, if you are booked for emergency CS, and pastor say we should wait, tell him to be praying where he is while we do the work, okay? So that nothing will happen to you and your baby. Do you understand? Imagine after vomiting for how many months, after carrying after suffering in pregnancy, then you now come to delivery and lose your baby. It is painful now. All right, let's go on, please. So this is our bundle of joy, as many of you will have very soon. Hi, yeah. Can you see this screen? All right. So now, all right. So let's go on, please. Let's go on. Now we are going to talk about the reason why a woman can have elective CS. Remember that we said that in elective CS, a woman can be booked. She'll be given a date where this when the surgery will be done. All right. One of the first reasons for elective CS, the CS that can be postponed, is number. Okay, I missed something. Oh, please let's go back to emergency CS. If a woman have severe hypertension, what that we call preeclampsia, okay, severe hypertension, and then we are checking her urine, we are seeing 2 or 3 pluses of protein in the urine, and the blood pressure is extremely high, it is emergency CS. So emergency CS, all right? I shouldn't have missed that one. So just put that one as emergency. Severe hypertension, preeclampsia, emergency CS. So let's come back to elective CS. The first one, if a woman have had 2 cesarean sections, subsequent deliveries will be CS. So if you have had 2 CS you cannot be allowed under any circumstance to attempt to deliver vaginally. Do you understand? So 2 CS. So that means for a woman that have had 2 cesarean section, she will just be scheduled and say, okay, you are going to have your CS once you are 37 weeks or when you are 38 weeks before you enter labor. So it is elective. It is booked ahead of time. So the woman know that she's going to have CS. The doctors know that she's going to have CS, all right, because she have had at least two cesarean sections. Number 2, abnormal lie of the baby. If you are a first-time mother, listen carefully. If you are a first-time mother and you are told that your baby is sitting down, that is breech when you are in labor, you cannot deliver vaginally. It's not as if you cannot deliver that baby vaginally, but there will be a lot of problem, and for many people, they will still end up having CS. So, if you are a first-time mother with a baby sitting down when you are in labor, please just go for elective, because every doctor that knows what he or she is doing, we always tell you that, madam, don't even try having vaginal delivery when your baby is sitting down and you are a first-time mother, because that pelvis has not been tested. Imagine baby strong. Now, when a baby is coming with the head exerts pressure on the cervix. The cervix opens up. But if a baby is coming with bum, you will have contraction, and then it will be as if nothing is happening. Then the baby can come and the head will get stuck inside the womb. So it is dangerous to actually attempt vaginal delivery when your baby is sitting down, especially for first-time mothers. Now, still talking about abnormal lie, which is the number 2. If the baby is lying across, the head is by the right, while the leg is by the left. All right. Please, it is cesarean section. No, transverse lie, it is cesarean section. All right, and it has to be elective. So once you are 36 weeks and you do a scan, and the scan says that your baby is transverse, you repeat the scan at 37 weeks, it still says that that your baby is transverse lie. Please, you have to be booked immediately for elective CS, because even if you enter labor, you cannot deliver that baby. Again, fetal macrostomia. When the baby is too big, the doctor have checked and said that, madam, this baby is very big, or maybe more than 4 kg, and they don't want trouble in labor. It's better to just go for elective. So you know that your baby is likely gonna be a big baby. The scan has shown that the weight of the baby is 4.3, 4.5, or whatever it is, but above 4 kg. So for peace of mind, just be scheduled for elective CS and be told that, okay, come to so and so day and have your baby. Simple. Again, multiple pregnancy. It's not that a woman cannot deliver twins. You can deliver twins, but if the first twin is not coming with head, it is gonna be cesarean section. Did you hear that? Let me have a thumbs up if you heard that. All right. A woman can deliver twins vaginally, but if the leading twin is not coming with the head, you cannot deliver vaginally, because you are gonna end up causing a very big problem for yourself and those 2 precious babies. All right. So for multiple pregnancy, if you are carrying twins and those twins are tangled together, or the one that is coming first is sitting down, or they are all lying across, or they are all twisted on each other, please, you will not be allowed to enter labor. It is gonna be cesarean section, elective. So most times for people that have twin gestation, they will just be booked ahead of time and say, okay, madam, at 37 weeks, babies are coming out. In fact, if you are carrying twins and the pregnancy is giving you a lot of problem, at 36 weeks, they can come out and they will do very well. All right. Then the next point we are going to make is precious baby. Imagine a woman that has been married for over 10 years and then she now became pregnant. It's a precious baby. For such women, you just advise them gently, please go and have CS. Don't even attempt vaginal delivery, because it is more risky to have vaginal delivery than to have cesarean section. Or maybe a woman who the first pregnancy, she's already above 35 years. The very first pregnancy, she is above 35 years. Please, for such person, and maybe they've been looking for babies for a long time, and this child is very precious, to avoid stories that touch the heart, cesarean section, elective, she will just walk into the hospital and have her baby. Everybody go and rest, because we don't want stories. So, or maybe a woman that had IVF. All of you know how costly IVF is, and some women will even try before one will enter. For IVF babies, cesarean section straight. I hope you are all listening. Please, if you are with me, I want to have a thumbs up again. Thank you. All right. So, IVF pregnancy, precious baby, cesarean section for peace of mind. All right. Now, some people as well can have cesarean section out of personal reason. They can just have cesarean section. Somebody can say, no, I'm traveling, no, or maybe I want to do this, or maybe I have an exam. Doctor, let me just have CS and rest. All right. So people from maybe out of personal reason can also have cesarean section. So we have actually discussed about the indication of cesarean, of both emergency and an elective cesarean section. Let's hurry up. Complications of cesarean section. The first complication, just like in vaginal delivery, is bleeding or blood loss. So we have that for during CS, you are going to lose blood, but in most cases of CS, we don't transfuse. But if you lost so much blood such that you need to be transfused, then we will do that. But you can actually have your baby through CS and not be transfused. But one of the complications of CS, all right, just like in normal delivery, is bleeding or blood loss. So you have to build up your blood very well before you enter labor. The other one is pain. All right. Now, in pain, of course, after the cesarean section, maybe from the following day, you will start having some pain in the operation site. But you are usually giving pain relief that should help you to deal with the pain. Number 3, infection. The operation wound can be infected or can break, and especially if it was not well dressed or if you exposed it unnecessarily. That's why after doing CS, you are told not to bathe until that wound has sealed up. Because if you bathe, you can watch all sort of things from your head, from your body, and then it will not go and infect the wound. So wound infection is another complication of cesarean section. Number 4, wound breakdown. 5, when you have one previous cesarean section, you know that the next pregnancy you will not be induced. If you don't enter labor spontaneously, you will be booked for another cesarean section. And when you have had 2 cesarean sections, for future pregnancies, they are still going to be cesarean section. Now, let me answer this question before you people start asking. A woman can actually have up to 4 cesarean sections, all things being equal. A woman can have up to 4 cesarean sections, all things being equal, especially if you are in a good center. All right, you can have up to 4 cesarean sections. Okay, some people will tell you 3, but you can have as many as 4 cesarean sections. All right. So we want to really try and round up so that we can take some questions. But before we discuss the last thing we have is pain management in labor. That's the last thing we have here, pain management in labor. But before we discuss that, let me still remind us again that this is the last class for this free January webinar. And we have our antenatal care too, our online antenatal care, just like what you are listening to now. We have a dedicated WhatsApp group where you will receive most of these teachings. All right, this is just a little of what we do. All right, and in our class as well, you will have the opportunity to consult a doctor. You can actually reach me directly, even privately, and then we talk about whatever symptoms you have or you experience, and then we can give you a quality advice or counseling regarding your pregnancy. Also, if you enroll in our antenatal class after delivery, we can still help you out at least within those first few weeks with tips about taking care of a newborn and all that. So it's a very holistic care that we render. It's just that it's not free, like you already know. And we actually encourage that many of you after this class this night will enroll. Of course, you know we are credible, and the lessons that the classes that we've taught you, what we've taught you today, if you listen to how I speak and how we have answered your questions genuinely, you can now imagine what we can do when you are committed in our antenatal class. So I want you all to make the sacrifice and enroll. All right, it will be very good for you in this pregnancy and even afterwards. All right, so having said that, let's go to the last one before we close the class today. Pain management in labor. Hi, if you are here, let me have a thumbs up, please. All right, pain management in labor. I know that all of you have been waiting for this thing. You've been waiting to say, doctor, what are we doing? When are we doing this? We are here now. Listen very carefully. All right, pain management in labor. Now, there are 3 ways you can control pain. All right, psychological control of pain, using drugs, and epidural. Epidural is still drugs anyway, but it's better that we split it so that we can explain better. Now, psychologically, we know that people have different thresholds of bearing pain. Some people can bear pain more, while others cannot really bear pain. So in labor, please, when you are coming to labor, don't come alone. Don't come alone. You women should come with your husband if they are around. Come with them. The men have to know what you pass through when you are in labor. Now, what is psychological control of pain? You know, all those encouragement that you receive from the nurses, you know, they will tell you, madam, sorry, you know, your bundle of joy is coming very soon. Strong woman, you are doing very well. Just a little more push, the baby is coming out. Those are all psychological pain management. Then, for those of you that have delivered before, you know, you'll be having very serious waist pain, low back pain in labor, that you want someone to be massaging that place. That is a pain management. So that is why your husband must be around, though. If he's at home, he must be around so that he will be rubbing your waist, rubbing it, massaging it, and the pain will be going. In fact, hold the shirt, if possible, tear the shirt. You know? Yes, drag him. Honey, you are the one that gave me this condition. No, you gave me this condition. And then he'll be saying, oh, baby, sorry. Baby, sorry. Baby, sorry. And some of our men, they will start crying with you in labor room. You know, we've had other things. Doctor, is there nothing you can do for my wife? So psychologically, we can manage the pain. So by encouraging you and urging you to go on, you are not alone. Go on, continue, and then the level will be going. And then, so that is psychologically. Now, drugs. If you register before you register for antenatal, ensure that the hospital, that during labor, that they give people pain relief, because it is not every center that even give women drugs to relieve pain. But one thing you should know is that no matter the amount of drugs you are given, it will not completely take out labor pain. Are we there? In fact, by the time you enter second stage, that is the stage that you are fully dilated, that the pain is as if you want to craze. No matter the drug you are giving, except you are on epidural, you will still feel pain. But we have hospitals that give different kind of pain relief while in labor. Unfortunately, I don't want to start mentioning names of drugs now, so that you will not either misquote me or abuse them. But please register in a place that can give you some certain level of pain relief in labor. At least if the pain was 100% before, by the time you are giving some medications, the pain will come down to 70%. Like I say, it will not go away completely. The only method of pain control in labor that will make you not to feel one bit of a pain is epidural. Epidural anesthesia. You can see this picture here. This is a woman in labor. They are trying to give her injection in her back. This is a woman's back. This is the lower back. So they are trying to give her injection here. This injection is going straight into her spine. Now in epidural, what they are giving now, all right, after numbing the place, epidural have a long thread, like a long rope. So they will put it, they will insert it past that needle, the distance through here, through where they are giving this injection. This injection is just to make her not to feel pain when they are going to carry out that procedure. Now, when they have inserted it, it's a long coil at the back. They will plaster it along her back. It will come out to the front. So what they have to do is to be pushing drugs through the cannula that's already in her back at this point where this needle is. What you are seeing here, okay, they are just trying to numb the place. Although this is also the same way that spinal anesthesia is done. But epidural anesthesia is different from spinal. All right. In spinal, after giving this thing now, the woman will not be able to carry her leg again. But epidural, you can move your leg, you can talk, you can roll, you can do everything. Spinal, once you are giving spinal anesthesia, that one is not for labor, that one is for Caesarean section. That's the one that if you are giving, you will be awake throughout the surgery, but you will not be able to move. But epidural is still given in the same place, but it is given in a different method and not the same drug anyway. So we attach the cannula at this point, and then it enters the spine. We now plaster it. It will come out to the front of the woman, and then we'll just be injecting the drug through that cannula. The drug will be going straight to her back, straight to the back, straight in the spinal canal, and then the woman will just be sipping zobo while labor is going on. She will just be listening to music, and then baby is coming. Now, many of you will now ask, what is the complication of epidural? One of the complications of epidural is back pain. You know, some people will say, okay, that site that you are giving the injection, you might actually feel some pain afterwards. But of course, even that one is not permanent. After some days, you will not be feeling pain there anymore. Again, in the second stage of labor, when the cervix is fully dilated, if you are using epidural, that urge to push will not be there. Or even if it's there, it will be reduced. That is to say, a woman in labor, a woman who is in labor and is not using epidural, such woman, once she have entered second stage, that is when the cervix is fully dilated, she will have the urge herself to be bearing down. But if you are on epidural, it will delay that second stage. You will just feel so relaxed, so relaxed. You will not, except you are not to madam push, you will not really have that very hot urge to start pushing. But eventually you will still deliver your baby. Some people will say, if you don't have the urge to push, that means labor will delay now. No, not necessarily. Labor will not really delay. Although for some people, maybe you might have extra 30 minutes or 1 hour from the time that you are normally supposed to deliver. But overall, you will not feel pain, as long as they keep on injecting the drug, because each time they inject the drug will have to last for some time. It will start running out. So when you start having pain again, they will inject again. So what some people now do is that when you are about to deliver, they will stop putting drugs in that place so that you will have the urge to push. Do we understand? Please let me have a thumbs up if you understand so far. All right. Now, that's about epidural. it is very effective, but it is also costly. Epidural is costly, and it is not everyone. All right. It is not every facility that have the ability to do epidural. So there are some places that you will go and deliver. You know how this country is, right? So some hospitals do not have the service of an anesthetist that will insert this epidural. So for many people that don't have the privilege of being in such centers, my dear, you will just have to try and bear the labor pain with a lot of sorry. And please hold on until baby come out. So this brings us to the end of this class. In conclusion, safe delivery is when both mother and baby are fine, regardless of the means of delivery. All right? As long as you and your baby are fine, you had a safe delivery. Number 2, ensure you register in a hospital that have professional caregivers. No go quack place, I beg. Go to a hospital that have doctors, that have people that can care for you. Number 3, seek advice from experts. Please stop asking those old women or all those market women. Seek advice from experts. Sometimes when you Google the symptoms, you are going to be confused. That is why we are here. Reprogens is here for you. Come on, we there for you. Spend that cash, just 10K. Give it to us. We enroll you in our antenatal class. Shikena. And then bombard us. In fact, wound us with questions. Wound us with your calls. All right? So, seek advice from experts. Okay? See, I'm actually hoping that after this class, a lot will start dropping in our accounts, all right? Because a lot of you will be willing to be part of our antenatal class because, we don't try, all right? So register in our online antenatal class for more quality lectures and expert guardians. We just talked about labor and delivery and cesarean section. We have not talked about a lot of things. Hypertension in pregnancy, diabetes in pregnancy, twin gestation, people who are draining, like that is premature rupture of membrane, how to manage it, psychological this thing, people that have a lot of psychological issue in labor, depression in pregnancy, anxiety in pregnancy, how to take care of a newborn. We've not talked about any of those things. Are exclusive for people in our antenatal group. So if you want to enjoy this kind of quality lecture, it's just 10,000 naira. I'm talking like a real marketer here. But on a more serious note, that's it. All right. So, ladies and gentlemen, I'm still me, Dr. Emmanuel. This is the end of the class. God bless you all. Thank you. Questions, please. All right. Hi guys. We have 15 minutes to answer questions so that we can prepare for the second group who will be in the class. So let's start taking the questions. Earlier on today, we said that we are going to try to limit that we will try to limit our answers or our questions to what was discussed. So I don't know how we are going to do this, but I will pay more attention to questions that are bordered upon what we have talked about. Anyway, I'll just try my best to see how much I can answer before the time elapses. This question here said, Can HIV patient taking her drugs do exclusive breastfeeding? And can the baby also take baby food alongside with breast milk? I hope you all can hear this question they are asking. Can you hear the questions? All right. Please, a HIV patient who is taking her drugs, in as much as the person is taking her drugs, we want to minimize the risk of the baby being infected. So we don't want her to breastfeed. All right. Because HIV can be transmitted through the breast milk. We don't want her to do breastfeeding. But even if she must do breastfeeding, she will have to do exclusive breastfeeding just for a few months, let's say just for 3 months, and then she will stop. It is not advisable for a HIV patient to do mixed feeding. So you cannot give breast today and give baby food tomorrow. No, please, no. The answer is no. So as much as possible, we don't encourage HIV mothers to breastfeed the baby because the virus can be transmitted through the breast milk. All right. So what we just do is that once such person delivers, we commence the baby on baby food and on HIV medication as well. All right. This one says, can a woman in labor take water? If yes, is it room temperature or cold water? A woman in labor can take water, but a little water, because some people, when they are having labor pain, they can start vomiting. So we don't even encourage that a woman who is in labor should have a full stomach. But because labor can take a lot of time, and the woman from screaming should be dehydrated, so she can take water. So the answer is yes, a woman in labor can take water, whether cold water or room temperature, it doesn't matter. But just take enough to quench your thirst, okay, so that you don't start vomiting. This one said, for placenta previa and a woman is going into emergency cesarean section, you said you will first save the mother before the child, but I have heard of situations whereby the husband will tell the doctor to first save the baby. What will you do in such a situation? Now, what I meant by that is this. If a woman is bleeding, the woman has placenta previa and she's bleeding. If she comes to the hospital on time, before the baby, that if the baby is still alive by the time you are opening her up, you can save both of them effortlessly. But some people, before they come to the hospital, the baby must have died. So you are focusing on the mother because the baby is already gone. You will not now come and start wasting precious time to start, of which, for us as doctors, now my work is to deliver the baby and hand over to the other medical team to start doing what they have to do if there is anything that can be done. But I will not abandon the woman who is on the theater to start going to breast a baby. I hope you understand. All right. But generally speaking, all right, every doctor will always want to save the woman. All right. We always want to save the woman. So that is it, because as long as the woman is alive, she can always have other babies. Please, what's the side effect of epidural anesthesia for delivery? I thought that, please. This question came before I thought it. How can a pregnant woman build her blood? Please go back to the group. Go back to the group. Question: does avocado make babies gain excess weight? Avocado. No, it doesn't. Can a woman be given pain relief after labor delivery? And how do they manage the trauma so not to have depression after childbirth? A woman can be given pain relief after delivery. Yes, now, after passing through the pain. Of course, now, she'll be given even injection pain relief, tablets and all those things. She will be given, please. And how do they manage the trauma so as not to have depression after childbirth? Postpartum depression, which is depression after childbirth, is a very serious issue in women. No, it's very serious. All right. In fact, some people say after delivery they will start avoiding sex. They will be so scared of having intercourse. I have seen women that after delivery, 3 months they've not had intercourse with the husband. because they are still scared that they are going to get pregnant, maybe because of what they passed through. So it is true. So if you are a woman and you have you start feeling depressed or anxious or something after delivery, please seek the help of a specialist. All right, seek the help of a specialist so that they can help you to come out of it. All right. This one said, after this free class, will the group be closed? I mean the free group. Well, after this class, we will decide that one. But definitely, the group will not. Anyway, let me not go ahead of me. After this class, we decide whether the group will remain closed or not. Thank you so much. This was a great webinar. I'm glad I didn't miss it. Thank you so much, Alice. We are glad you are here too. This one says, can a woman deliver with anterior position? Do you mean if the baby is facing anteriorly? Please, you will have to ask this question again in the group so that I will really understand what you mean by anterior position. Let me not make mistake in the answer. Please, you mentioned severe hypertension will result in C-section. What BP range is considered severe? Okay, now, severe hypertension, blood pressure above 160 over 100 and above. Please, it is safer to have CS. If your BP is 160 and above, it is safer to have CS because when labor pain starts, that blood pressure will still climb again because of pain. So now imagine, and then the complication is that if your BP keep on climbing in labor, you may even start having convulsion, that start having seizure on the table. It is a very terrible thing. Okay, so ideally for a woman who has severe hypertension, all right, we just encourage for the person to just have sex because any small stress or pain can even make the blood pressure to start going up again, and that will not be good for you, and that will not also be good for the baby. In fact, if you are in this group and you have hypertension in pregnancy, please by all means try and register with us so that we can guide you properly. Okay, because one of the problems with hypertension in pregnancy, that's severe hypertension in pregnancy, is sudden fetal death. Some women can just wake up to it and then they now saw that the baby is not moving. Problem. All right. Thank you, doctor. Okay, I think I've answered this question. He said, thank you, doctor. Great lesson. Please, at what value of high blood pressure is bad during delivery? I think I've answered it, please. What causes bleeding in? Okay, this one says, how bad is a 1+ of protein in the urine? 1+ of protein in the urine is not bad, especially if your blood pressure is not high. But if your blood pressure is high and you have 1+ of protein, you must be on constant follow-up. Do you understand? You must be on constant follow-up. And that's also, there's this thing we call in pregnancy-induced hypertension, all right? Until the baby comes out, that blood pressure will not go back to normal. All right, so we just keep on managing it until the baby is strong enough to come out. But if you have 1+ of protein in the urine, you have to be constantly monitored. The moment it is 2+, just know that the baby will have to come out in the earliest possible time so that you don't lose your baby. I hope you understand, and even yourself, so that you don't also start having seizure or convulsions while you are pregnant. Okay, so this one says, what causes bleeding in early pregnancy? 8 weeks and 5 days. Have been a scan. Okay, I have a scan there and the baby is intact. The cervix is closed. Yes, still bleeding. Already used 2 pads. What can the person do? Please, so if you are bleeding and you are 8 weeks, I don't know, does this bleeding come with pain? If the bleeding came with pain, then it is threatened miscarriage. That means the pregnancy is at risk of being miscarried. Okay, so, but if it's bleeding, it depends also on how serious that bleeding is. Is it a big bleeding or a small bleeding? All right. If it's just spotting, it can just be due to placenta implantation. Okay. But whatever be the case, if you are bleeding at 8 weeks and the bleeding is not like you've already used 2 pads, please go to the hospital, let them thoroughly examine you. Okay? It's possible that the pregnancy is at risk of being miscarried, so that they can do whatever they can to stop the bleeding and to ensure that your baby stays. All right. So that brings us to the end of this class, everyone. So thank you so much. It was good doing business with you. All right. Every other question should be directed to the group. Thank you and God bless. All right.